Good morning, students. Today we'll see about the instructions given in organon about case taking. First, let us understand what is case taking. Case taking is a process. What is case taking? Case taking is a process by which the physician P, by which the physician is able to perceive, again a P, and collect. Case taking is a process by which the physician is able to perceive and collect what? Symptoms of the patient. P, physician, perceive, patient, P. So case taking is a process. This is also again a P. So P is very important in case taking. Case taking is a process, P, first P, by which the physician, second P, is able to perceive, third P, signs and symptoms of the patient, that is fourth P. And patient has to be in front of us. On call, patient is on call, that is not a case taking. Patient is on video call, that is not a case taking. He has to be in front of us. He has to be presented in front of us. So case taking is a process by which the physician is able to perceive in the sense understand fully the symptoms presented by the patient and collect signs and symptoms of the patient. Why? To diagnose the disease and to diagnose the patient. What we are going to do? We are diagnosing the disease and diagnosing the patient as a whole. So what is case taking? When this comes as a definition, we have to say in this format: case taking is a process by which the physician is able to perceive or collect the signs and symptoms of the patient who is in front of us or before us, to diagnose the disease and the patient as a whole. Okay. According to our master Hahnemann, what is case taking? Case taking is the individualizing examination. Here also, individualizing examination is giving preference to I. Individualizing examination of whom? Of a case of a disease, not just a case. Whenever Master Hahnemann says, he says case of a disease, person in disease, person in health. His language is in that way. So Master Hahnemann says individualizing examination. You are conducting an examination to individualize whom? A case of a disease. You are individualizing a case of a disease. This is by our Master Hahnemann. What is the objective of case taking then? Objective of case taking is to discover. Discover माने जो नया है उसको खोजना. Discover what? I of the patient. Always Master Hahnemann has focused on the word I. So objective of the case taking is to discover the I, individuality of the patient in disease, of the person in disease, of the patient in disease. Okay, this is the objective of case taking. So here we can get a MCQ or we get oral viva questions. What is case taking? You have to elaborate this. What is case taking according to Master Hahnemann? This individualizing examination of a case of a disease. And what is the objective of case taking? To discover the I of the person in disease, to discover the individuality of the person in disease. Very simple thing. Now for case taking, regarding what are the instructions given in organon regarding case taking? It is given in the aphorism 83 to 104. You could understand it is given in 83 to 104. Now we will understand one by one how and what are the instructions. 83. Aphorism 83. Aphorism 83 says, before case taking, to conduct an individualizing examination of the patient, of the case of a disease or of the person on disease, to conduct the individualizing examination of a case of a disease, you have to have necessary qualities. To play an international cricket, you have to have played Ranji Trophy and local state games. So that is a criteria. In the same way, to conduct an individualizing examination of a case of a disease, you have to have some necessary qualities. Necessary. This is compulsory. Qualities. Necessary qualities. What are the necessary qualities to conduct the individualizing examination of a case of a disease? These are 4 given by our master Hahnemann. First is freedom from what? Prejudice. Prejudice. Second is sound senses. Third is attention in observing. Fourth is fidelity in tracing the picture of the disease. Picture of the disease. These are the 4 essential qualities, necessary qualities required by the physician to conduct an individualizing examination of a case of a disease. Freedom from prejudice. Prejudice in the sense, for influenza, I have given arsenic that worked very well for 10 patients. I will give again to this patient also. This is prejudice. You have to be free from that prejudice. Every case is a new case. Every case is a new case. Every game is a new game again. Sound senses. साउंड सेंसेस का मतलब ये नहीं है कि साउंड को पसंद करें, हमारे सेंसेस साउंड को पसंद करें. साउंड सेंसेस मीन्स you have to be sound enough. What the patient is telling, you have to be sound enough to grasp it. पेशेंट कुछ और बोल रहा है पर उसकी खांसी कुछ और बता रही है. Then if you have sound senses, you can pick the exact picture of the cough. Okay, he's coughing in front of you. That means you have to concentrate on that sound. You have to concentrate your senses, all the 5 senses. Okay. Patient, you are asking, do you perspire? Sweating हो रहा है क्या? नहीं बता रहा. No. But when you touch the wrist, you feel moist. This means the patient is perspiring. You have to have that sound senses. Next is attention in observing. You have to observe every minute details during the case taking. You have to be attentive how the patient is telling. Is he shy? Is he bashful? Is he timid? बता नहीं रहा है, फिर थोड़ी देर बाद सब कुछ बता रहा है, फिर इतना बता दे रहा है कि वो रो रहा है, इमोशनल हो जा रहा है. This is attention in observing. If you don't give enough attention, you cannot observe these minute details of the patient. That is required. Aphorism 83. In the first aphorism of case taking, 83, he has given this all qualities required by the physician. To acquire these qualities, all the qualities, it will take more than 5.5 years. And last is fidelity in tracing the picture of the disease. Fidelity. You have to be true. You have to be true to trace the picture of the disease. So these are the 4 criteria given in the aphorism 83. Regarding case taking in different aphorisms, aphorism 84. Physician has to remain silent. What is aphorism 84 states? Physician has to remain silent. Physician has to remain silent. That means you do not have to interrupt. You have to avoid interrupting to the patient narrating his complaint. When the patient, small p, is narrating to big P, the physician, you do not have to interrupt it. This is aphorism 84. During case taking, never interrupt the flow of complaints, the narration of the patient. Understand? 84 aphorism. और कुछ नहीं है. You have to remain silent. Now 85 aphorism. Whenever the patient is telling some complaint, what you have to do, you have to start from a fresh line. अभी कुछ कंप्लेन कंटिन्यूसली बोला, उसको फ्रेश लाइन से स्टार्ट करके हो गया. फिर कुछ बोला थ्रोट का, फिर स्टार्टिंग से फ्रेश लाइन से स्टार्ट करना है. फॉर एवरी न्यू सिम्टम बिगिन विथ ए फ्रेश लाइन. ओके, ये वाला भी हो गया. अफोरिज्म 85. 86. आफ्टर रिमेनिंग साइलेंट, आफ्टर राइटिंग ईच कंप्लेन इन ए फ्रेश लाइन, when you feel that something is missing, you have to precisely elicit the elements. Suppose location, sensation, concomitants, modalities. You have to elicit the elements to complete the symptom. To complete the symptom. So aphorism 86 क्या बोल रहा है? You have to precisely complete the elements. You have to precisely complete the elements to complete the symptom. If the patient is missing out on modalities, you have to ask modalities. If the patient is missing out on the causation, you have to ask causation. If the patient is telling something about sensation but is not able to clearly tell, you have to elicit the sensation. This is to complete the symptom. 86. Complete the symptom. Aphorism 87. Physician should only ask open-ended questions. The questions must be in such a way that when you ask, it has to have a long answer, a short answer, not multiple choice answer. Understand? You have to ask, do you have thirst? Yes or no? We do not ask that way. We have to ask, दिन भर आप कितने पानी पीते हैं, कब कब ज़्यादा पीते हैं, पूरी ग्लास पीते हैं ना, कैसे पीते हैं, आप बताइए, थोड़ा विस्तार से बताइए. So you have to ask open-ended questions. हो गया? Aphorism 87 states you have to ask open-ended questions, not the questions which yes, no. Are you constipated? No, yes. That question should not be asked. Those are closed-ended questions. You have to ask open-ended questions. Aphorism 88. What it says? This is again very important, because here Hahnemannian view and Kantian view are similar. Interrogation about the general symptoms. Here Hahnemann also has given importance to general symptoms, and Kant also has given importance to general symptoms. So interrogation about the general symptoms of the patient. Here Hahnemann also is giving importance to general symptoms, physical generals, mental generals. Hahnemann has given the importance. कोई अगर पूछे, केंट तो जनरल सिम्टम्स को बहुत हाई वैल्यू दिए हैं, Hahnemann दिए हैं कि नहीं? अगर दिए हैं तो कौन से एफोरिज्म में दिए हैं? 88, 2 fat ladies, 88, aphorism 88, you can remember easily. Aphorism 89. अगर precisely location, sensation, this is missed out, you ask in 86. If you want something more special, something more precise, which is left out, you have to ask in, that is aphorism 89. More precise or special questions which are needed to get the portrait of the disease picture. You can ask. That is 89. But you do not ask in suddenly 84, no interruption. You have to ask when the patient has exhausted. उसका symptoms निकलते कहते 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 खत्म हो गया. Now you can ask more precise or special questions. This is aphorism 89. Aphorism 90 क्या बोल रहा है? Now you have to observe. Attention in observation is a quality given in aphorism 83. That quality you have to bring out here. Observe what? The symptoms which are peculiar in the sense when the patient was healthy, patient was in a healthy state. What are the peculiar symptoms of the patient? Which is very peculiar. वो हमेशा रहा है उसके साथ healthy condition में. That you have to observe. Let it be in disease condition or no. But in a healthy condition में जो symptoms है, that symptoms you have to observe. You have to ask those symptoms which are very peculiar to the patient in healthy condition. Okay. This is aphorism 90. In case taking, all say which symptoms have to be taken. During analysis, they ask which symptoms have to be taken, the present symptoms or the earlier symptoms. We say change in disposition. Earlier में जो था अब change हुआ उसको लेना है. But the symptoms which are more peculiar, वो कभी उसके healthy state से गया ही नहीं. उसका जल्दी से खाना स्पीड से खाना सब लोग बैठे हैं, उसका खाना खत्म हो गया है. This is hurriedness. Yes, this symptom is peculiar to the patient in the healthy state. Very peculiar. जब भी खाना दिया जाएगा सबसे पहले वही उठेगा, खत्म करेगा वही उठेगा. This is hurriedness, hastiness. Not hasty, it is hurriedness. That is very peculiar during the state of the health. Healthy symptoms have to be taken in aphorism 90. Now 91, what it says? Aphorism 91. Aphorism 91 states, when the patient has come to you, but before coming he has taken some treatment and then he has come to your chamber. Patient is coming to you, but he has taken some course of treatment. So what are the guidelines that is given in aphorism 91? How to deal with such type of cases, how to do a case taking in such type of cases, that is given in aphorism 91. It will be also already taught in your organon syllabus, aphorism 91. Now aphorism 92 is conjoint malady. Not only one malady, double malady, double role. Conjoint malady, the discussion about the disease picture and the medicinal disease. After taking medicines, the medicinal disease, medicinal drug disease and the natural disease, conjoint malady. It will be also taught in organ. Aphorism 93. We have to trace, or we have to find obvious cause. Obvious cause. उसका cause क्या था? We had also discussed in some classes that एक 19-year girl आ रही है acne के लिए. But when you trace again, you ask precise questions. 86, you complete the symptom. 89, you ask more precise questions, and then you find out that she had a recent लव डिसअपॉइंटमेंट, उसके बाद से उसका एग्जाम्स खराब हो रहे हैं, एंड शी हैज पिंपल्स ऑन द फेस. नाउ व्हाट इज द ऑब्वियस कॉज? लव disappointment. Love disappointment. This is the obvious cause. You have to trace it. Aphorism 93 says you have to find out the obvious cause. Aphorism 97. Whenever you are dealing with a chronic disease, homeopath physicians encounter more chronic disease patients. So whenever you are dealing with chronic disease, you have to scrutinize what particular circumstances, कौन से circumstances में ये chronic disease हुआ है. Psoriasis of a patient, now you have to scrutinize what were the circumstances. Ailments from domination, उसके मामा पापा उसको ये मना करते थे. उसके बाद he has in a society where his views are not listened, he is dominated. This way, ailments from domination leading to depression, and then he is getting psoriasis, chronic disease. So you have to trace the particular circumstances. उसके लाइफ circumstances से लेना है. लाइफस्टाइल लाइफ इन्वेस्टिगेशन जब करते हैं, not diagnostic investigations, life investigations, life space investigations, you have to ask how was your childhood, how was your adulthood, and how you have reached this stage. Then we get the particular circumstances which directly or indirectly lead to the psoriasis or कोई भी chronic disease. Okay, this is aphorism 94. Aphorism 95 is lesser accessory symptoms. Lesser accessory symptoms. He is feeling these symptoms are less. These symptoms are accessories, not the main symptoms. He is suffering always from diarrhea, loose stool, but he is never complaining of that in your case taking. He is thinking ये तो मेरे साथ हो ही रहा है. 4-5 दिन के बाद alternate diarrhea, alternate. Now aphorism 96. This is dealing with hypochondriac or hyper and hypersensitive patients. छोटी सी बात बड़ी बड़ी और उसी की सोच में डूबे रहते हैं. हाइपर सेंसिटिव, स्मॉल थिंग्स हर्ट, एंड hypochondriac patients how to deal, and hypersensitive patients how to deal. This is given in aphorism 96. This is given in aphorism 96. You can see hypochondriac and hypersensitive. Aphorism 97. This gives instructions regarding case taking of indolent persons. Indolent or timid, और who are presenting with false modesty. जो है वो दिखाते नहीं हैं, चुपचाप रहते हैं. और indolent, lazy type of patients. For this, instructions are given in aphorism 97. So whenever the question comes in repertory point of view, repertory case taking point of view, it comes that indolent patients or the patient who is showing false modesty, उनके रिगार्डिंग इंस्ट्रक्शंस कहाँ पे केस टेकिंग में दिए हैं, उनके रिगार्डिंग केस टेकिंग कैसे करना है कहाँ पे दिए हैं. देन यू विल से 97. It will be asked in which aphorism this is there, or this is there in which aphorism. Reverse way also it can be asked, because our subject is repertory and Case taking. So homeopathic case taking. The instructions given in aphorisms are also included in repertory. It is also included in organon. So aphorism 98. We have to give credence, माने इम्पोर्टेंस देना है किसको? केस टेकिंग में पूरा केस टेकिंग कर लिए हो, उसके बाद किस चीज़ को ज़्यादा इम्पोर्टेंस देना है? पेशेंट के ओन वर्ड्स ऑफ द पेशेंट जो लिखे हैं आप, उसको ज़्यादा इम्पोर्टेंस देना है. हो गया. अफोरिज्म 99. In acute cases or acute disease, how to investigate a acute disease? Investigation of acute disease. Aphorism 100 में क्या है? Investigation of totality of symptoms of epidemic disease, epidemic or sporadic disease. Totality of symptoms of epidemic and sporadic in aphorism 100. In aphorism 101, how to elicit the true picture in epidemic disease. 101. And aphorism 102, genus epidemicus. How to find out the genus epidemicus in epidemic, how to find out the remedy, taking which all consideration of symptoms of different patients. Aphorism 103, investigation of whole manifestation. सब लेना है किसमें? chronic disease में. Chronic disease, investigation of whole manifestation of chronic disease, especially सोरा जहाँ पे है, सोरा. And aphorism 104. Last is aphorism 104. Here you have to select the similimum and follow-ups. So this is regarding the instructions in organon regarding case taking. This is a syllabus in chapter in term 1. So we finish one chapter in term 1. Students, please go through it again and again so that you can remember it. Thank you.